Now let's talk about the kind of situations where you might send a handwritten thank you card to. Here's one that comes to mind. How about the patient that just completed some really nice quality dentistry? It doesn't have to be, full mouth reconstruction or anything, but maybe they just replaced old failing amalgams. And you could send that patient a thank you note. Hi, Linda. I want to take a minute and thank you for your commitment to your health. You just chose the best that dentistry has to offer. I wish all of my patients were as committed to their health as you are. Thanks for being part of our patient family. Sign it. Okay. Another example. What about the patient that has moved? This happens in all practices. Patients chose your office and then later moved, or maybe accepted a job somewhere else. Maybe they came to your office because your office was near their previous employment, and now they're in a different job. But they keep coming to your practice because they love you, right? And in some cases, they could have moved, 45 minutes away, an hour away in urban areas. Think about that in Mississauga, Naren. They wouldn't have to move very far to be 45 minutes away with your traffic patterns. But they keep coming because they like you. So you can say, dear Bob, we realize you drive a long way to come see us. Thank you for your loyalty and confidence in us. It means the world to us. Thank you for being part of our patient family. Another great card, right? Here's another situation. How about those patients on your schedule that are just the ones, I call them the bluebird patients. They're the ones that when you see their name, you literally just smile. We all have the opposite of those in the practice. When you see their name, you're thinking, I think I should call in sick today. But I'm talking about the other side, the patients that, you just see their name on the schedule and say, oh, I'm so glad I'm going to see Maria today. She always makes me happy. Just write her a thank you card. And in the thank you card, just say, Maria, I just want to thank you for being part of our practice. When I see your name on my schedule, I know I'm going to have a great day. You add such a wonderful presence to our practice. Thanks for being part of our patient family. And sign it and send it off. How about the patient that is just your faithful patient, always shows up on time, always keeps their recommended hygiene appointments. Whenever you make treatment recommendations, they respond. Just recognize what a wonderful patient they are. And because nobody does this anymore, nobody sends out handwritten thank you notes. These thank you notes are going to stand out in their mind. They're likely to have a place, on their mantle, on their kitchen table. Maybe they'll put a magnet up and put it on the fridge. It's the kind of thing that other people will talk about. Does that make any sense, Naren?
Absolutely, Gary. It totally makes sense. I mean, I know it has become almost like a relic, right? I mean, thank you notes. We don't get them very often. I mean, how many times you get a personal handwritten birthday card these days, right? I mean, like a lot of the things that comes with the handwriting is so rare nowadays. So when you get it, especially from your doctor who you look up to and put on a pedestal, it shows how much they care about you, right? Yeah. I mean, it totally changes the game. It just makes you part of their family, part of their healthcare family that they totally depend on and trust. And those relationships can last 30 years, 40 years. And I have doctors who talk about, kids, grandkids, the extended family. There's like 40 people they're treating from one person they saw 20 years ago. It's crazy.
To punctuate this point, I literally, now I know our listeners can't see this. Naren and I are on Zoom and we can see each other, but I literally can reach about 5 feet over on my bookcase. I'm in my home office. That's also my recording studio. I can reach over to my bookcase and I can hold up. In fact, I'll do it just for fun. Naren, what are you seeing me hold up?
I see a handwritten thank you note that you got from one of your clients.
It's a handwritten thank you note that I received from one of my clients. Yeah. And it simply says, Gary, I just wanted to take a minute and say thank you. Thank for all you've done for my practice, but I also want to thank you for all you've done for the dental profession. Your work is making a massive difference, not only in my life and the life members of the lives of my team members and the lives of my patients, but I know you've helped many practices, and I just wanted to take a minute and personally say thank you. I appreciate all that you do. And where does this live, Naren? This lives in a place of pride on my bookcase. And
Yes.
it felt good to receive it,
Yes.
right? I mean, it's old school. This stuff has disappeared from our culture, from our
Yes.
everyday occurrence. And, you mentioned earlier, but because of that, it makes it more impactful. It makes it
Yes.
more impactful. Now, I would suggest that you keep some kind of a simple log of who you're sending notes to. Because you certainly don't want to send the same exactly worded note to the patient the next time as well.
Yes.
So keep a log of these, but set a goal of sending four or five of these out every day, and stick to it. Naren, one of my personal characteristics and habits is that of discipline. I think you recognize discipline a little bit in my personality, Naren.
Yes, I do.
Yeah, like for example, my running.
Yes.
Yeah, I'm OCD on discipline. I thank my grandmother for injecting that characteristic into me in terms of impressing me on how important it is to be disciplined. This requires some discipline. If you send 2 or 3 out today and then you forget for another 2 or 3 months and you send 2 or 3 out, that's not what we're talking about here. We're talking about a consistent format of writing these notes. It's not going to take much time. In fact, if you look at the return on the investment of time, I'm going to suggest that the return on that investment would be really, really, really good.